everyone, I'm Natalie Kunsman, MD, and today we have a topic that is somewhat of a puzzling diagnosis of ALS. Now, ALS, also known as Lou Gehrig's disease, is amyotrophic lateral sclerosis, and it is a neurodegenerative disorder that leads to a destruction of motor neurons. So, to explain it, A means no, myo refers to muscle, and trophic means nourishment, so it literally means no muscle nourishment. Now, the lateral portion of the terminology is the area in the person's spinal cord where portions of the nerve cells and signals that control the muscles are located, and it's at this area that it degenerates and it will lead to scarring or hardening, which is sclerosis. So the lateral sclerosis. Now, the lateral horns of the spinal cord are where the motor portion of the body's control are located. So it is the motor control that becomes faulty in this disease process. So it begins focally in the central nervous system, and then it will spread. And in the clinical findings of the diagnosis, it's actually defined by a progressive upper and lower motor neuron findings, and we can confirm that by EMG, which is an electromyogram. And additional testing that we might do is really just to rule out any other conditions. So like any of the neurodegenerative diseases, ALS is thought to have a little bit of a genetic component, which maybe 5 to 10% of cases we believe may be inherited. And then there are genetic factors, age, tobacco use, interestingly, athleticism, which may contribute to the sporadic cases of ALS, but the major causes at this point are still and as of yet unidentified in patients. But here is what we know. It strikes between ages 40 and 70. The military vets have about twice as much incidence of this disease as compared to the general population. So the presentation, or what I have seen in several of the cases that I have had of ALS, the patient may begin falling, breathing troubles, the inability to speak, the inability to walk, or have even any muscle control of sitting, holding the neck, or even difficulty maintaining secretions such as the saliva. Now, unless there are other neurologic conditions compiled with the ALS, cognition is typically preserved. So again, it is a complex pathophysiologic process which may include mitochondrial dysfunction. There is an aggregation of misfolded proteins. There are oxidative stresses. There is neuroexcitotoxicity, inflammation, and some apoptosis of the motor neurons and the surrounding glial cells to those motor neurons. So there may also be some clinical overlap to ALS with some other neurodegenerative diseases such as the frontotemporal dementia. Now, there is some breaking news. There is a novel explanation that is panning out in the laboratory, finding that the TDP43 binding protein that should be very high in the nucleus of our cells and very low in the cytoplasm is almost in a reverse process. So these protein byproducts in TDP43 will be more of a solid state and clumping rather than a loose gas-like state, which allows it to be very permeable. So what this happens is there will be these conglomerate aggregates of the TDP43 protein that will be in that cytoplasm in those lateral horns and create that scarring phenomenon such that there will no longer be the electropotential because those neurons at that neuromotor junction are dying. Now, there are meds trying to target this, but some of the medications that are currently on the market are not exactly going after these inflammatory and protein aggregates. So currently, as far as other triggers, we're trying to see if heavy metals or inflammation from environmental agents are also factors to consider, which are actually disrupting this process of the gateway between the nucleus and the cytoplasm, getting those proteins stuck in the cytoplasm and not back to the nucleus. So an optimal regimen to treat a patient may actually require some of those nutrients and supplements with this motor neuron disease to maybe delay the effects and the progression of the disease and maybe slowing or reducing some of the symptoms. So already, again, I'm integrative, so I will incorporate everything that I know for a disease process. So we heard about some of the medicines on the market and some up and coming targeted medications, but we're actually finding that vitamin E may delay the symptom onset and slow the disease, and that is actually protecting from the lipid peroxidation of those cell walls and neurons. Now, selenium may also help, as well as glutathione. And we're also finding that ginkgo biloba has antioxidant properties, and we've known that as far as brain health, but it may actually promote healthy mitochondrial functioning in those motor neuron complexes in that lateral horn of the spinal column. So what we also believe is the ginkgo biloba is protecting from some of the glutamate-induced excitotoxicity, causing some of that death to the tissue. Now, there's also some promise using CoQ10, which is critical with the electron transport chain for that proper mitochondrial functioning. And there is a study out there finding that supplementing, in other words, taking CoQ10 by mouth will reduce the weight loss and delay the motor deficits and extend the lifespan by a little bit with this motor neuron disease. Now, acetyl L-carnitine has also been shown to inhibit some of that mitochondrial damage. And we go back to it helping to increase glutathione, which is very protective for our neurons. Now, as far as neuron protection, it has been well known that alpha lipoic acid is an antioxidant that may even not only increase glutathione, but help with chelating any heavy metals depositing, such as iron or copper. Exciting news with green tea, which its key component is EGCG, which is a catechin found in the green tea, which has mild chelating effects. But again, there is a study showing that the green tea extract delays symptom onset and prolongs lifespan. Pycnogenol has also anti-inflammatory properties, again, protecting from the glutamate excitotoxicity. So some of the procyanidins, which are in your grape seeds, your cranberry, blueberry, almond, peanuts, also demonstrate some of the antioxidant properties. I'd like to talk a little bit about DHEA, naturally occurring steroid, mostly produced in our adrenal glands, has been shown again to protect against glutamate excitotoxicity. So if we are hearing a common theme, the answer is to block glutamate-induced toxicity. We have a lot of vitamins that will protect, which are the B vitamins, vitamin C. Again, we talked about alpha lipoic acid and ginkgo biloba, but also N-acetylcysteine and vitamin D3, phosphatidylserine, acetyl-L-carnitine, creatinine, and when those people go through a good liver detoxification program, that is helpful as well. We are learning a little bit about human growth hormone. Of course, that's prescription only, but considered a repurposed medication to help with that. Neurodetoxification, if we are using IV phosphatidylcholine followed by leucovorin and then followed by glutathione. Now, this all requires an experienced physician, and it's typically either a neurologist or an integrative physician may help with this. Again, integratively thinking, let's go after the potential neuroexcitotoxins that we already know, such as heavy metals, pesticides, PCBs, in hopes that we may find one of those triggers. Now, I want to give you fair information regarding another prototype illness that is similar to ALS, and that's polio. So we may actually find or gain some insight into an infectious etiology triggering off the cascade of events. Now, the Eastern approaches are going to go after why the body is sick in the first place and get to some of the deep-rooted subconscious triggers. And if there was ever a call for energy work, it is for these neuromotor complexes that are at fault and that are dying, and how can we get the electrical potential over the junction if it is broken and dying. So we need to consider RIFE or EMF, the NES system that can measure it, PT and OT workers to get some of that muscle charging and firing. And again, when we go back to the lateral horn, lacking its nutrients, the biggest nutrient is oxygen. So we may need to consider oxygen, hyperbaric oxygen, to nourish those neurons and that neuromotor junction. So summarizing ALS, the treatment requires a multidisciplinary approach. This may require a neurologist, a pulmonologist, movement specialists, assistive devices, technologies that are outside of the traditional disciplines that may help survival rates. Again, I'm Natalie Kunsman, MD. Subscribe to my channel below. And until we meet again, be well.